Hi, this is Dylan Everhart. This is my trauma assessment. I have the patient with a below the knee amputation, and to start, just some the general assessment before they got there. They will be in the ambulance bay in 10 minutes. The patient was working at a sawmill and fell onto the saw and has suffered a right below the knee amputation. A tourniquet is in place. They have an IO placed in the left femoral head where he's receiving an LR bolus of fluid. When the patient got to the ED, his blood pressure was 70/38 with a MAP of 46, heart rate 150, respiratory rate 12, SpO2 94% on 2 liters. They're in a C-collar stabilization with a GCS of 7 and no response to pain. His H&H is 6.8 and 23. His distal pulses are absent, central pulses are 1+ and weak. The skin is cold and dry, and there's obvious leaking of blood from the tourniquet site. So now I'll start my assessment. So first we're going to activate the trauma team and just prepare the room with the fluid warmer and just heating the room up to prepare it for the patient to get there. And I'm going to put on PPE, gloves, and everything. So first with the patient, we're going to assess for uncontrolled hemorrhage. There is bleeding from the site below the tourniquet, so we're going to tighten the tourniquet and then feel for the pulse below, and there is no longer a pulse underneath it, and the bleeding has stopped. Make sure that's all right. Great. Okay, now that the bleeding's under control, we're going to assess her level of consciousness using AFib. She was not responsive to pain. She's not conscious. And then we'll have a second person stabilize her C-spine, and she's got the cervical collar already on. And then we'll open the airway with the jaw press maneuver and make sure in the airway there's no obstructing of the tongue, there's no loose or missing teeth, no swelling, no foreign objects in there, no blood or vomit or like secretions filling it up, no gurgling or stridor, and no like bony deformities within her airway, and there's not. Her airway is clear. We're gonna listen to her airway. Oh, hold on, I actually don't know if it's time for that yet. Sorry. First, and we're gonna identify if an advanced airway is needed, and her GCS was 7, so she does need an advanced airway. So for the time, we're gonna call the provider and ask him to come put that ET tube in, and we'll put the OPA in just to hold her airway for the moment while they get here. So now the provider has come, and they're gonna put in the ET tube so she can be on mechanical ventilation since her GCS is less than 8. Yeah, now we're going to move on to assessing her breathing. Is there spontaneous breathing? No, because she's on the ventilator. Symmetrical chest rise and fall? Yes, and then we'll listen and make sure she has bilateral breath sounds, and she does. Her breathing's being controlled by the ventilator at this time. Yes, her breath sounds were present when I listened and equal. And there's no tracheal deviation or JVD for this patient. So now we'll move on to the circulation. We will look for uncontrolled hemorrhage again. There's no obvious bleeding from where she was amputated. And I'm just going to feel the pulse again. And there's still no pulse below the tourniquet. Now we're going to look for her central pulses. Her carotids are present but weak, and there are no distal pulses. Oh, I forgot to do this earlier, so I'm sorry, but I would, whenever we got the ET tube in, after 5 or 6 breaths, put the carbon dioxide detector on there, and it turned, so the rest are. The ventilator is working. We did look at the rise and fall of the chest, and it was symmetrical and moving. And then we already listened to the lung sounds when the ET tube was placed, and then we would also listen over the epigastrum. and there was no gurgling there. We would also look and see the number of the teeth and mark it, and then tie it or just secure it so it won't move. Yes. Okay. Okay, now we'll check her skin for color, temperature, and moisture. We read that her skin was cool. Sorry, I'm just looking back at the assessment. And dry. Okay. Now we'll look at the pre-hospital IV line. It has the LRs running through it, and it is patent. And we'll also need to place another large IV catheter into her other arm. We will administer warmed isotonic crystalloid fluids with the blood tubing in case we need to give her blood later at a controlled rate. Now we'll palpate all 4 quadrants of the abdomen. And then her flanks for injuries, and then her pelvis for injuries, all just good upon initial assessment. We'll apply pressure over the iliac crest of the patient in, or downward and in, and then also over the symphysis pubis, and her pelvis does not seem to have any injuries or instability. And we'll assess her neurologic status with GCS. So first it was 7, but we'll assess again for her best eye response, pain response, and eye response, verbal response, and motor response. We'll assess the pupils, and her pupils are equal, round, and reactive to light. We'll assess her skin and the temperature. So we'll look for any external hemorrhage again. The site is still not bleeding. We'll check for the pulse one more time behind the knee. There's still no pulse below the tourniquet. The need for the warming blanket, her skin was cool and dry, so we will put this blanket on her, get her warmed up. And then, we'll palpate the skin for warmth, and we can say her skin was cool. So now we'll just get a full set of vitals. And then the labs, so we'll get a typing screen of the blood gases, and a lactate. Attach her to the cardiac monitor, so we'll put the things on. And then we have the cardiac monitor back here. We'll consider inserting an NG or OG tube. I think we should do maybe an OG tube with the ventilation. And then consider weaning the oxygen. And her oxygen was 94% on 2 liters, and she's on the vent. And then we'll attach the patient to capnography. She's on the ventilator. And we'll assess her pain. So she can't tell us what her pain is, but she probably is in pain from the amputation. So we'll reposition her and just put padding over any bony prominences or any way we can make her comfortable. Then for the interventions, she'll probably need blood because her blood pressure is so low, and she lost some through the amputation. Maybe some pressors to get her blood pressure back up. Probably a good mattress just to prevent the skin breakdown since she is unconscious and on the ventilator. Probably just the trauma panel labs, see how she's doing. And yes, thank you for watching my trauma assessment.